Oh, why do I feel so dizzy?
Ever wonder why you feel dizzy when you stand up too quickly?
Wait, how did you get in my room? But, yes?
Let me show you what's going on in your body. When a person stands up from lying down, there is a huge postural change that causes the blood in the body to redistribute to the lower limbs. Initially, this would cause a decrease in mean arterial pressure. Which forces the body to compensate for this by increasing cardiac output. And increasing heart rate. But that's just the initial response. Let's look at this in a bit more depth. So what is the orthostatic challenge? Well, it's when a person moves from a supine position to a standing position, and your mean arterial pressure initially drops as the blood moves to your feet. But how does this affect the heart? Well, this causes a decrease in venous return, leading to a decrease in end diastolic volume, decrease in stroke volume, decrease in cardiac output, and an overall decrease in heart rate, which ultimately causes a decrease in mean arterial pressure. This drop in blood pressure or low blood pressure is called hypertension and is what can make you feel a bit dizzy.
In response to this, the body induces vasoconstriction of blood vessels in the feet to redirect blood back to your upper body. This compensatory response increases your venous return, stroke volume, heart rate, cardiac output, and mean arterial pressure to restore the body's homeostasis and adequate blood flow to your brain.
Depending on the patient's severity of hypertension, it alters their symptoms, from acute to chronic to asymptomatic and symptomatic. Some are unlucky and experience severe dizziness leading to leg buckling, loss of vision, and sometimes loss of consciousness. The risk of injury due to collapsing increases the probability of other induced injuries such as head trauma and broken bones. However, more commonly, orthostatic hypertension leaves the patient with lightheadedness, generalized weakness, blurry vision, and nausea. The regular alterations in blood pressure is also associated with the development of cardiovascular diseases and stroke due to the risk factors.
To reduce or improve the feeling of dizziness, you should try to move your legs a little before standing up, and then stand up slowly. This gives your blood pressure time to adjust. Also, it's very important to eat and drink well, as dehydration and lack of nutrient intake can also lead to dizziness.
If you think dizziness is becoming worse or is becoming a problem, you can seek treatment by a professional and use medications to help. For those with serious hypertension, further treatment and assistance is required. Patients may be recommended to wear compression stockings, as these promote blood return to your heart. Several drugs may also be used to treat low blood pressure. The most commonly prescribed of them are fludrocortisone and midodrine. Midodrine works by tightening or constricting blood vessels, which increases blood pressure.